Good morning, and welcome to a Milwaukee for All, a special three-part series brought to you by the Greater Milwaukee Foundation. I am Jackie Hurd-Barber, Chair of the Foundation's Board of Directors, and I am glad you could join us for this critical conversation about early childhood care and education, the focus of today's event, and a major focus for the Foundation. We are here to listen, to learn, and most importantly, to drive action together toward the solutions our community needs most. Like Dr. Andre Perry said during our first event in June, nothing grows without investment. We all can appreciate the value of a high-quality education at any age, but the impact of early childhood care and education spans generations. It is vital to unlocking economic potential for countless people in our region, now and in the future. It allows parents of young children to participate in the workforce. As a result, it affects the whole labor market and should be the business of any employer of working parents. It's also the best investment we can make in a child's long-term academic, social, and developmental success. But far too many families across Milwaukee, especially Black and Brown families, do not have access to quality early care and education they can afford. This was true before COVID. A study the Foundation commissioned called A Seat at the Table found that half of all Milwaukee children lack access to the services they need due to gaps in cost, quality, hours of operation, and ages served. The pandemic has increased these disparities and heightened this crisis in every way. And we need innovation and action now more than ever. The Foundation has a long history of supporting education, and today, early childhood education is among the highest priorities within our strategic vision of a Milwaukee for All. Over the last 2 years, we have deepened our commitment, our investment, and our partnerships in this space. Together, we are focused on solutions that will transform the early care and education systems so it works for everyone. Our guest experts today have some specific ideas on where to start, and I can't wait to hear their thoughts. Sherry Killen Stewart is Director of State Systems Alignment and Integration and Co-Director of State Services for the BUILD Initiative. BUILD is a national organization that partners with state leaders to promote equitable, high-quality child and family-serving systems that result in young children thriving and learning. Rian Evans-Alvin is CEO of the National Association of the Education of Young Children. NACY promotes high-quality learning by connecting practice, policy, and research. In just a moment, Rian and Sherry will join Foundation President and CEO Ellen Gilligan for an important dialogue to set us on a path to action. But first, I'd like to introduce my friend Ann Terrell, a Milwaukee leader and career professional in early childhood care and education. Ann is the board president of NACY and is going to offer us a moment of inspiration for our discussion today. Welcome, Ann.
In communities throughout this world, the well-being of those communities has been determined by a number of factors. Some American indigenous tribes, like the Oneida, practice the seventh generation principle, whereby they believe that decisions made today should result in a sustainable world 7 generations into the future. And among the most accomplished and fabled tribes of Africa, no tribe was considered to have warriors more fearsome or more intelligent than the mighty Maasai. It is perhaps surprising then to learn of the traditional greeting that passed between the Maasai warriors. Kase se siengera, one would say to the other. It means, and how are the children? You know, it is still the traditional greeting among the Maasai, acknowledging the high value that they always place on their children's well-being. Even warriors with no children of their own could always give the traditional answer, all the children are well. Meaning, of course, that peace and safety prevail, that the priorities of protecting the young and the powerless are in place, and that the Maasai Society has not forgotten its reason for being, its proper functions and responsibilities. All the children are well means that life is good. It means that the daily challenges of existence do not preclude proper caring for its young. It means that the decisions we make as community members must ensure that we will be able to answer, all the children are well. And so, Milwaukee, how are the children?
That was absolutely beautiful, Anne. Thank you for reminding us why we are all here. And thank you, Jackie, for your leadership on the foundation board, as well as with Milwaukee Succeeds. Your dedication to the learning and development of children in Milwaukee sets a remarkable standard. And I am so glad to have learned from you and with you for all these years. We're so grateful for everyone attending. Thank you for leaning in together as we strive for an early childhood education sector in Milwaukee that gives children the best possible start in life, exceeds the expectations of families, and supports the success of providers and educators. As you heard from Jackie, early childhood education is a strategic priority and a long-term commitment for the foundation. Our work and support of the sector to date demonstrates the foundation's unique strength as a convener, bringing together a broad coalition of partners, experts, and community members around shared goals and solutions. We have demonstrated our commitment to this work over many years through our aligned work and support of Milwaukee Succeeds, our grant-making, convening, the commissioned IFF research, a seat at the table, our civic response team work, and much more. I'm the mother of 2 adult sons, and I'm personally passionate and committed to this work. My sons had the benefit of having both wonderful and loving and nurturing home-based care and center-based care, and I believe every child deserves the same opportunities. I want every family to have the choices that meet their child's needs, their family's needs, and that they can afford. And I am a fierce advocate for the teachers and providers to be paid appropriately for the critically important work that they do. We are so fortunate today to be joined by 2 brilliant women who are contributing so much to this field. Welcome, Sherry and Rian. Your experience with early childhood education issues nationally will provide new perspectives, insight, and ideas for advancing our work. Before we begin, I'd like to briefly define our terms so we're all on the same page. There is no question we need an aligned education system that works for all kids, cradle to career. In this conversation, though, when we say early childhood education, we are talking specifically about the system of care and education for our youngest children before they enter the K-12 school system. This is a system of largely private child care and education programs. Some are structured as centers, some are based in homes. There is limited public funding invested in this system, so by and large, this is a private market funded by the fees paid by parents. We also enter this conversation with a common understanding and passion that early care and education is critically important for a child's development and learning success. This is not babysitting. Finally, quality early care and education is a skilled profession and plays an essential role in the long-term futures of our little ones. With this common understanding, let's begin our discussion. So I'd like to start with a personal question for each of you. And Sherry, I'll start with you. Before we dive into the sector's challenges and potential solutions, could I ask you why you're so passionate about this work?
Thank you so much, Ellen, for having me and for the work that you're doing in Milwaukee and in Wisconsin. I'm a first-generation college student in my family, and so I know the pathway and the struggle to get there. I've also had the privilege of sending 3 daughters to college. I know that people like you and I make decisions every day that include or exclude people, offer opportunities or take them away, make exceptions or offer consequences to communities and programs and individuals. And I realized early that it didn't matter whether I was in healthcare, I started my career as a nurse, or I worked in economic development or with foster care children. Individuals were designing, implementing, enforcing policies based on their knowledge, their experience, their fears, and their desire to manage risk. So, working with leaders to help them see their own roles and responsibilities and authority is a passion for me. Together and individually, we can shift the public policies that have benefited some and excluded others for so long. So that's what gets me up every day.
And what makes you passionate about this work?
Yes, thanks, Ellen. Also, I just want to echo Sherry's comments about how great it is to be with you. I similarly, I think it's really important to recognize that we have the privilege of living in a democracy, and we are having a constant tension about, what is our collective responsibility in a democracy. And what do we have to handle personally? And that's always the tension in policy work as we're debating where we spend our tax dollars and that sort of thing. And we're now sitting on 25 years of neuroscience that says this is the most important investment that we can make. The economic data is enormously clear that this is the most important investment we can make. So there are mountains of evidence. And we also, that there's no better investment. And we also have this story that we tell ourselves about access to the American dream. And in some ways, that's a falsehood. I heard a Fortune 500 CEO one time likened that to a game of Monopoly, that everyone starts go with $200. And as you go around the board, it's a matter of choice and chance. But not everybody's starting go with $200. And we have put up and created structural barriers. And then I have 3 children, and this became very personal to me when I had kids. I know because of the zip code that I live in, I know because of the jobs I have, the unfettered access to higher education and healthcare and family supports, that my kids started out in an advantage and a privilege that other children did not. And it's just not fair. And so that motivates and drives me as well.
Thank you both so much for sharing your personal passion and your stories. I relate to much of what you said about the opportunities that we have and the choices that we can make in our positions. So, Rian, I'd like to stay with you for a moment. And we understand that NACCE has just conducted some important survey about the root causes of challenges in the sector. And that includes some really eye-opening data about Wisconsin. So can you tell us what's going on in the early childhood education workforce?
Yes. Ellen, I think COVID has really exposed the fragility of our system and the lack of supply, the uneven economics of the early childhood system, and supply and demand not meeting. And, we've built this system on the backs of the early childhood education workforce in incredibly low wages. And so we're seeing that play out in this COVID crisis. So even before COVID, we knew that the median average wage for an early childhood educator is typically below $11 an hour. 46% of early childhood educators are eligible for public assistance, that only 15% of early childhood educators have access to employer-sponsored benefits. And so not surprising, as everything kind of imploded with the public health crisis, so too did the early childhood sector. And many, many early childhood educators were laid off at the beginning of the crisis. And now there's an opportunity to rebuild the workforce, but programs are struggling to do that because there's not much incentive to come back to a job that is so high demanding and so low paying. So we've done 4 national surveys to help inform policy decisions here in Washington. And I just want to give you some disaggregated data about Milwaukee from our most recent survey. So we know right now that childcare centers and family childcare homes are operating at an average enrollment of 61%, which will be difficult for providers to stay open if that continues. And that's their enrollment. Average daily attendance is about 60%. So about a quarter of the kids who were there before, in essence, are there now. We know that 41% of the respondents said that they would have likely closed without the public support and federal public assistance that they got. These are 32% of these providers, of the family childcare providers, are minority-owned businesses. 76 of the respondents have used public funding for an increase in compensation, which is terrific. We also know that 78% of centers in Milwaukee are experiencing a staffing shortage. And 51% of those programs are serving fewer children as a result of that staffing shortage. 29% have a longer wait list, and 29% are unable to open their classrooms. And so, again, this sits on top of a situation we already knew was happening.
Well, that is very staggering information, but it absolutely reflects what we are hearing from our provider partners and the centers and home-based care providers on the ground here in Milwaukee, that they are having a very difficult time getting to capacity, attracting talent to work with the young children. So let me just follow up with you for a moment on that. So why, from a family's perspective, why does the challenge around workforce affect people's ability to access early child care and education?
Well, there's both a developmental and learning piece to that, and then also a pragmatic piece about working. We know that families don't work and parents don't work if their kids aren't safe and in high quality developmental experiences. We saw that in December. The workforce, it was all women who left the workforce in December, and so we've seen this has been a crisis for the last year and a half in the droves in which women are leaving the workforce as a result of not having access to high quality childcare. But it's also a developmental issue. We have this neuroscience that is so clear and explicit about the value of the early year of high quality early childhood education, birth to 5, what happens to young children birth to 5, and having consistent, reliable, high quality experiences is critical. And so when you think about the turnover and the unevenness in staffing, it's not good for families and it's not good for the development of children.
Mm-hmm. Well, thank you. So I'd like to shift to Sherry for a moment. So one of the questions that people always struggle with is, why does early childhood care and education cost so much, but educators get paid so little? Would you like to comment on that?
I think that if we look at the history of our early care and education, that it began often with minority women taking care of other people's children, and they weren't paid well, and they continue not to be paid well. It's hugely a field that includes women and hugely a field of minority women. So we as a society don't first pay any women, the same rate, and then we certainly don't pay minorities, and we haven't valued the care and the cost of providing care to children as something that we would publicly fund.
So that's a really important issue, and clearly the impact on women and, as you said, the historical nature of who have been the early care and education providers is an important perspective, and it's certainly the case here in Milwaukee. We are talking about broadly the issues facing the sector, And so what I'd like to just ask you about is clearly this issue does not affect communities and families equally. There are clearly areas and families and neighborhoods that are not well served, that early care and education is not available in certain communities. So could you comment on how you think the current system is perpetuating racial and gender inequities? You began to touch on it in your last answer.
Yeah, I'll posit three ideas: segregation, values, single solutions. One, despite all the legal changes that happened since the 1940s, especially the fair housing and voting rights, we still having difficulties with that today. There's an increase in inequity. There are still cities that may remain deeply segregated in our country. On values, we build an early childhood system based on a set of Anglo-European culture and values, and then programs and services emulate and reward those values, reward those assets. And it's an enormous benefit for some to have their children in home-based care or in settings where individuals speak their language. And our system often doesn't pay attention to that. Build Initiative had June Lee from the Fred Rogers Center speak at a Bill conference several years ago. And he gave us the example of toothpaste and said, when you read taste, there's one ingredient that's most important. And he talked about that regarding early care and education and said it's really the relationship and the trust that's built in those relationships. And then our country goes after single solutions. Our perspective is to take a big problem and come up with a single solution. And so we think about early education and care, and we make that opportunity for the family. But we don't look at the interconnectedness of transportation and housing and hours of operation. In fact, Bill was created in 2002 by the Early Childhood Funders Collaborative, both because we understood the brain science and we wanted to elevate that, but we also were frustrated by offering single pieces of a project. Often a project could be successful, but it wasn't connected to the other pieces. You know, all families want what's best for their children, but the options are often determined by where you live and your zip code and your neighborhood and dependent upon transportation. There's still communities without hospitals and library safe parks in their community. So when it comes to early education and care, we've also invested in the same pattern. We go to the place with the buildings, we go to the place with the space, and we've shifted away from those communities that I began with that are segregated. And our early education and care system is complex. Many states have multiple options, which can be very confusing for families, sometimes upwards 4 or 5 options. We talk about early education, we talk about care, we talk about universal preschool, and it's just a mix up for families to be able to understand. And leaders have a commitment to racial justice, but that commitment alone is not necessary. It's not enough. It's essential, but not enough. We've got to get leaders to listen and respond to the communities and the families that are there. They've got to be able to listen and build a relationship and start in the hardest places. We often start in the easiest places. And Bill really believes in that value.
Well, thank you very much. There are so many elements of the answer that you just gave that align with some of the work that the Foundation and Milwaukee Succeeds and our partners are trying to do. It certainly is borne out in the research that we conducted with IFF about the ecosystem in Milwaukee, what we have heard from parents about issues of trust and access and cultural, not only cultural competency, but cultural fitness for the centers and home care providers that people choose for their families, for their children. So those are hugely important issues. You talked about hearing, going and listening and really incorporating the voices of parents, providers, practitioners in this conversation. At the Foundation, we have centered community voice in all of our decision making. We are on a journey. I would not say we have arrived at that, but we are committed to really listening and incorporating community voice in the programs that we administer and fund and the solutions that we are advancing. So can you tell us what that looks like in practice? That is a really important issue for philanthropy in particular, because you talked about one type of solution that is supposed to be uniform across a community like Milwaukee that's very diverse, it's very segregated. So can you say a little bit more about what that looks like in practice?
Yes, I could give you a couple of examples. In one state where we're working, there was the issue of infant mortality, and using the data, they found 11 counties where infant mortality for Black women was an issue. And we intentionally went to those 11 counties and partnered with nonprofits in those 11 counties and took teams of people. This is critical for my earlier point that it won't be a single solution, that when you listen to community leaders, when you listen to families, when you listen to women, you will hear multiple issues. And so you need to be able to process and resolve it at multiple levels, at the state level, at the regional level, at the county level. And from that, we brought, and my favorite saying is quotes, not notes, back to a larger team to really process and say, what are they saying? What are the root causes? What's under their experience and what they're sharing? We use the framework of the social determinants of health because we know it's important not to just have a conversation about education, but listen about economic development and community and social context, health and healthcare, access and quality. And then created a set of recommendations that we then took back to the community and said, here's what we heard you say, and therefore here's what we think we should do. Is that good for you and your family? And in that instance, we got lots of feedback as we went back to those same nonprofit partners. And that's important because you want to build an ongoing relationship. You want to have feedback loops with community. In another state where we went back, what we heard wasn't exactly what that community resident meant. And we were able to refine what the solution was when we went back. And then we have to come back and do the tough work as a team. Build is about early childhood systems, that this isn't work that you do alone, that we all have to lean into the places that are most marginalized, think together about the solutions. Solutions don't come overnight. There's some things that are in our authority. We can make policy and practice shifts. We've done a lot of that in COVID around flexibility, which has mattered for communities. But then we need to take on the bigger challenges of making programs more available in the footprint of the families and children in ways that they will be interested in access them. And then most important, or as important, as that initial connection with community, because here's where we get it wrong. We listen at the beginning and then we go off and use our own knowledge to create solutions. We want to listen, and then we want to go back on the potential solution. And then we want to include that community in the design and in the implementation, build off the community programs that are already there. So often we come up with a solution and then we fly a program into a community to do it versus building off their strength and building their capacity. And then stay involved with that community to monitor. We won't get it right the first time, but we do need to make mid-course corrections, and we do need to do that together.
Thank you so much. I mean, those are such important lessons for everyone in Milwaukee that is working on this cross-sectoral work to advance a system that works for all families, and certainly has really important implications for the Greater Milwaukee Foundation, for our partner Milwaukee Succeeds, is how we approach the work and how we continue to both center family voice, but also go back and listen to make sure that we got it right? Because I think that sometimes we don't always incorporate what we're hearing in a way that actually works for people. So I really appreciate that. So Rian, I'm going to go back to you for just a moment. We have had some really exciting and important developments at the federal level with regard to investment and potential investment in early care and education. So could you tell us a little bit about that and what you think the opportunities and implications are for those of us in places like Milwaukee who are so committed to this work and advancing this work?
Absolutely. We are at a moment in time where we're seeing the proposal for exponential increases in public investments in early childhood education. And so the American Families Plan, the text of that bill is out, and Congress will be debating it along with the infrastructure bill in September. And our sense is that a version of both of them will pass. That's our hope and our thinking right now. It has enormous implications for early childhood education, but states are going to have to make really important decisions. So what we see in the text now is that there's both a child care initiative and a universal preschool initiative, along with paid family leave and tax credits for middle-income families to make high-quality early childhood education far more accessible to all families. In the current language, states are going to get to decide or have to decide whether they're going to take the federal money or not. And within that, they will be required to come up with a match. It is disproportionately money coming from the federal government. But for example, in the child care section, it's 90% federal money, 10% state money. And so it's a really important moment, Ellen, for advocates to set the stage in their states to say, okay, this is our number one policy priority, and we're going to make this happen. There are fabulous provisions in it on structural issues and structural fixes that we've been advocating for literally decades. And they're in there that create a floor of quality, that create an evenness in how providers are paid. So they're not wondering if they're only going to get paid if a child shows up. And so the structural fixes are, to me, as important as the financial opportunity. And so this is a moment for states to really double down on early childhood education and to say, indeed, this is our top priority. I think the other piece that's important is access to higher education for early childhood educators. The science is clear about why it's so important for early childhood educators to have access to associate's degrees and bachelor's degrees and master's degrees. And yet, just for all the reasons Sherry's talked about, there is extraordinarily uneven access to higher education. And so there's also a lot in this bill that would acknowledge that we've got to eliminate the structure barriers that are preventing early childhood educators, and particularly early childhood educators of color, from fully accessing the opportunity of degrees in higher education.
That's really very helpful. Thank you so much. It does sound like we have reached a moment in time that for those of us and those of you who have been working on these issues for many, many years, it is the moment in time where we can really push ahead on really expanding opportunity and access and quality to our earliest learners. And to Sherry's point, really focus in a laser-like way for children who have not had this opportunity, and for families who have not had this opportunity because of cost and barriers and access, et cetera. So I am interested in, are there questions that, particularly for philanthropy, for advocates, for those of us who are working in a cross-sectoral way in a place like Milwaukee, are there questions that I have not asked you that you would like to give some comment to or instruction about the role of philanthropy, individual philanthropists? So this is your moment to give us some advice.
So, the bottom line is this system has four payers in it, the financing of early childhood education. It's the public sector, it is employers and employer-sponsored childcare, it's parents who are paying more than in-state college tuition for the cost of early childhood education, willing to pay their fair share, but they're paying more than their fair share right now, and it's early childhood educators in suppressed and low wages. Parents can't pay more, and early childhood educators can't earn less. And this is an opportunity right now that is not going to come along for another 50 years. So we have to seize it. And I can think of so many examples in our history, Ellen, where philanthropy has been the catalyst for massive change in this country. And this is the moment for philanthropy and business leaders to play an unequivocal leadership role in making sure that Wisconsin takes advantage of this opportunity that is coming your way, that is about public will. It's about public will and overcoming the politics of what has held back early childhood education for so long. But we know it's good for families, we know it's good for communities, and we certainly know it's good for children. And so I just think that when it comes to Wisconsin taking advantage of this opportunity, advocates, philanthropy, and business leaders coming together with one message, one voice, to say this has to happen. And it is absolutely essential that this happen, and that the political leaders, the policymakers in your state, do the right thing for children and families.
Thank you, Rian. And Sherry, would you like to join in this conversation?
Yeah.
And the other sector, I think, what we learned in the pandemic is that it's good for business. It's good for the economy. Yeah. A healthy early childhood care and education sector is good for the economy.
Yeah.
Excuse me, Sherry.
And agreed. Business is critical. I will mirror part of Rian's answer and say that philanthropy can really support people to work together, to cause people to work together, that this isn't about a single solution. And often people don't feel they're funded to do the cross-system work, to be in the room together, and to have a shared set of outcomes. So there are states that are finding a way to say, anything we do, how does it impact children and families? And I think that goes for business and chambers, as well as state leaders in health and education and other components. I also think that you can support and encourage the collection of information from the communities that are marginalized, that may be farthest from opportunity. I think you should be curious when you say, well, they don't have the capacity, or we can't fund them, because to look at the root causes and see how you can build bridges and not blocks. Because so often we can figure out easily why we can't do something. And in fact, that's a history of disinvestment. And as Rian said, this is a moment when we'll have the resources where we can lean in and really grow and begin to build some bridges.
Thank you both for that wonderful, rousing challenge to all of us on the local level, and for those of us in philanthropy to build bridges and not blocks. So I really appreciate that. So I feel like we could spend the morning here talking about these issues, and I want to both provide an open invitation for you to come back to Milwaukee anytime and spend a lot more time with us. You have so much to offer us and teach us, so I really want to thank you for the time. The dialogue has been so fantastic, and I know that we want to keep it all to ourselves, but let's transition now to our On the Table Milwaukee portion of our event, so the community can join us in this discussion. I know that I'll be thinking about the comments that you made about equity, about low-wage workers, and about the role of philanthropy in building bridges and bringing people together across sectors, and that this is our moment in time to really ensure that all children have the opportunities that our children have had. So now we have 8 focused discussions planned that will be led by local experts on a range of topics critical to advancing early childhood education in our region. And thank you to each of these dynamic leaders for guiding us towards solutions that will increase equity and access in the sector. Prioritizing early care and education is one of the ways that Foundation imagines building a Milwaukee for all, and it will truly take all of us to do this. So thank you again, Sherry and Rian, for your expertise. Now let's get started.
Hello, I'm Sue Ela. I am a proud board member of the Greater Milwaukee Foundation. And wow, what an inspiring, informative presentation. Thank you, Sherry. Thank you, Rian. Thank you, Ellen, for that discussion. I think that everyone can tell by the energy in the conversation that we are focused on this issue of early childhood education, and we are very focused on action and doing something about it. You can tell that the system we are living with is not working well for families or providers. We have not ensured that all families, especially with Black and brown children, have access to the quality, affordable early childhood education that they deserve. And the economic pressures of the pandemic, combined with the fact that we undervalue professional workforce in the field, is at the heart of a crisis that is long overdue for real change. So the experts today have shown us that there are very tangible solutions to these priorities. And we don't have to be incremental, we can be transformational. Our experts today showed us that there are tangible solutions to these problems, but they're not simple solutions, they are systemic solutions. And we don't have to be incremental, we can be transformational. Right now is the time that as federal relief programs are going to bring hundreds of millions of dollars to Milwaukee. And we can raise our voices together and advocate for generational investment in early childhood care and education. Our speakers today talked about philanthropy is the catalyst to bring people together, that advocates, philanthropy, business leaders can come together with one voice, and that is our intention, to be that catalyst and investor in this change. In fact, if you care about this issue, we would love to include your signature on a letter we'll soon be sending to local policymakers. It includes recommendations for how to leverage this funding for profound change in this sector. We will reach out to you about this opportunity for collective impact in the days that follow. Let us work together to remind our city and state leaders that quality early care and education is the single best investment we can make in our young people. I believe Sherry said there are mountains of evidence how effective it is. It can lead to better performance in school, higher likelihood of graduation from high school, better chances for a good paying job, less incarceration, better health outcomes. In other words, everything we want for our children and our communities. And if we invest now, especially in our early care and education workforce, the return on investment will be substantial. It's estimated that there's $9 of community benefit for every $1 invested. So this is how we will achieve a Milwaukee for all. We'll do it together. Very soon you'll be receiving ideas from the foundation on how you can learn more. You learned more today by participating in this session. Invest more and do more to have a positive impact. So watch your inbox. And don't forget that we have one more A Milwaukee for All event coming this year, which will feature Darren Walker, who's the president of the Ford Foundation. And he will talk about reimagining philanthropy to center it in social justice. In the meantime, thank you. Have a great day.